Good day, everyone. Today, we are going to talk about basic first aid. This will help us understand what to do in case of emergencies and how we can give immediate care to someone who is injured or ill while waiting for professional help. First of all, I would like to introduce myself. I am Cadet Captain Zaren J. Silveres, second class, and I am 21 years old and currently resided at Murok Bantod, Barangay Tabobaybay, San Enrique, Negros Occidental. And these are my educational background. I graduated my elementary level at San Enrique Seventh-day Adventist Elementary School, my secondary level at San Enrique National High School, and currently in tertiary level at Bago City College, taking the course of Bachelor of Science in Criminology. My achievements are I completed the Basic Reserve Officers Training Corps or the ROTC in the year 2024 and also completed the prescribed course of instruction of Cadet Officer Candidate Course Class Makaligon year 2025. These are the lesson objectives. Upon the completion of this lesson, you will be able to first identify first aid, identify the aims of first aid, identify the responsibilities of a first aider, identify the two classifications of wounds, identify the steps for treatment of wounds, identify the steps for treatment of heat cramps, identify the steps for treatment of heat exhaustion, identify the steps for the treatment of heat stroke, identify the steps for the treatment of nosebleed. First, let's define first aid. First aid refers to the emergency and immediate care you should provide when a person is injured or ill until full medical treatment is available. So, ang first aid, ito ay tumutukoy sa pang-emerhensyang lunas na agad na ibinibigay sa isang taong may sakit o nasugatan, bago pa man matanggap ang ganap na gamutan mula sa mga profesional na manggagamot. Now, let's define first aider. First aider is someone trained to give immediate medical assistance or first aid to an ill or injured person until professional help arrives. Their role is to provide initial care, stabilize the person, ensure that they are safe from further harm, and contact emergency services if necessary. So, ang first aider naman siya ay isang individual na may sapat na kaalaman at kasanayan sa pagbibigay ng pangunang lunas. Ang kanyang tungkulin ay alagaan at patatagin ang kalagayan ng pasyente. Tiyakin ang kaligtasan nito laban sa karagdagang pinsala at pakipag-ugnayan sa mga serbisyong pang-emerhensya kung kinakailangan.
Good day everyone, I am Cadet Captain Sudayon Jersey M, second class from Bago City College. So today I'm going to discuss the 5 main aims of first aid. So we have here the 5 main points or aims of the first aid. First, to preserve life. First, through the first aid, it preserves lives simply as protecting and saving lives. Second, is to prevent the escalation of the illness or injury. This simply means that through the help of first aid, it prevents the illness or injury in becoming worse. Third, promote recovery. Promotion, recovery, or rehabilitation from illness or injury. Number 4, providing pain relief. Providing pain relief to illnesses and injuries lessen the harm to an individual. Lastly, we have here to protect the unconscious. Through protecting the unconscious person, it ensures the safety and security of his or her situation. So let's proceed to the next topic, the responsibility of a first aider. First, they assess the situation quickly and calmly. In assessing situation, it is very crucial to every first aider to assist quickly as possible and with calm treatment. Number 2. Protect yourself and the patient from any danger. First aider should make sure the surroundings are clear, away from danger, and the situation of the first aider is safe before performing the first aid to an injured individual. Number 3. Prevent the infection between you and the patient. This is very important because the first aider must know the possible consequences he will deal with beforehand, including infection and escalation of illnesses. Number 4. Comfort and reassure the patient. The first aider should assist the patient gently through giving comfort words and assurance that everything will be okay. Lastly, we have here the assist the casualty and give first aid treatment. You must first cater the casualties and provide first aid treatment immediately. So let's proceed to the next topic. Our next topic is soft tissue injuries. Soft tissue injuries, also known as wound. It is an injury to the skin, muscle, nerves, and blood vessels. So, under the soft tissue injuries, there are two classifications such as closed and open wound. So, the first one is closed wound, wherein it is an injury where the skin remains intact but the underlying tissue are damaged. So, example of closed wound are contusion and hematoma. So, let's proceed to the last. On the other hand, the open wound is the break in the skin that exposes internal layers to the outside environment, making it susceptible to infection. In short, it can be seen. Examples of these are puncture, amputation, laceration, and many more. So, that is the difference between the open and the closed wound.
My topic for today is about closed wound. Before I start, I would like to introduce myself. I am Cadet Captain John Lloyd Palma, second class of Class Makalig-on. I live in Barangay Crucing, Pulpandan, Negros Occidental. My educational background in elementary education, I graduated in Ilinita M. Sao Elementary School. In secondary level, I graduated in Our Lady of Lourdes Academy. In my tertiary level, I am currently studying at Bago City College as third-year criminology student. I also graduated of basic RTC and advanced RTC. What is closed wound? Closed wound is injury to the soft tissues beneath under broken skin. Ito yung uri ng sugat na walang hiwa sa skin surface pero may damage sa loob kaya ng pasa at bukol. We have types of closed wounds. We have contusion or bruise and hematoma. The word contusion is the medical term of bruise. In Tagalog ay pasa. Ito yung pamamaga at pagbabago ng kulay ng ating skin surface dahil sa pagputok ng ugat sa loob. Iitim naman ito or asul or violet dahil naman sa dugo na namuo sa loob. Ang hematoma naman ay parang pasa rin, pero ito ay mas masakit sa normal na pasa. Ito ay mas maraming dugo na namumuo sa ilalim ng balat o laman. So we have signs and symptoms of closed wounds. We have pain, tenderness, swelling or discoloration of suspected site of injury. Ito naman yung pananakit ng katawan or paglambot ng laman. Swelling or discoloration of suspected site of injury. Ito naman yung pamamaga at pagbabago ng kulay ng balat. Bleeding from the mouth, rectum, vagina, or other opening. Ito naman yung pagdugo ng bunganga, rectum, vagina kung sa babae. Vomiting bright red blood or dark colored coffee ground. Ito naman yung pagsusuka ng mapulang dugo or maitim na dugo. Signs and symptoms of shock Ito naman yung pag nakaranas yung katawan mo ng shock ay posibleng isang sign ito or symptoms of closed wounds. First aid treatment for closed wound. First thing is to call for help para ma-ensure natin na safety yung pasyente natin at maiwasan natin yung paglala ng kanyang injury. And we have the ICE treatment or method. ICE is stand for I for stand for ice, and C for compress, E for elevate, and S for splint. ICE, ito yung nakakatulong para mabawasan yung pamamaga at pamumuo ng dugo. At for compress naman, ito yung maiwasan yung paglala ng pamamaga. Pero wag masyadong maigpit yung pag-compress para yung daloy ng dugo ay hindi maputol. E for elevate. Itaas natin or elevate natin yung parte ng katawan na may pasa. Ito ay nakatulong para mabawasan ang pamamaga ng parte. And first S is splint. Ang splint naman ay ginagamit natin para ma-stabilize yung parte ng katawan. Kasi hindi natin alam na may bali yung pasyente or may posibleng mas malaking injury.
Good day everyone. I am Cadet Captain Ronel Carl Rio, 2nd class, and I am from Barangay Lagasan, Bago City, Negros Occidental. For my educational background, I studied my elementary years at Munting Tinig Learning Montessori, and I finished my high school at Brookside Garden Academy. At present, I am a third-year criminology student, continuing to pursue my growth as a cadet, a student, and a future law enforcer. Outside of my academic and cadet life, I also enjoy basketball and spending time with video games, which both help me balance discipline with relaxation. Today, I'll be presenting a very important topic that concerns not only us cadets but also people in everyday life. Open wounds and their first aid treatment. Why is this important? Because accidents can happen anytime and anywhere, whether it's in training, in our daily activities, or even in unexpected emergencies. Knowing how to respond properly can save not only our own lives, but also the lives of others. So in this report, I'll guide you through what open wounds are, the different types we may encounter, and of course, the proper first aid steps we need to remember. What is an open wound? So let's start with the basics. What is an open wound? An open wound is simply an injury where the skin is broken and the tissue inside is exposed. Now remember, the skin is our first line of defense. So once it's open, germs and dirt can easily enter, making the infection a real threat. This is why first aid is so important. It's not about completely curing the injury right away. Instead, it's about controlling bleeding and preventing infection and keeping the person safe until the professional help arrives. Types of open wounds. Let's move on to the different types of open wounds. There are 5 main ones that we'll focus on. Number 1, laceration. This is basically a cut or tear in the skin, often caused by sharp knives, like sharp objects like knives, broken glass, or even jagged metal. Some lacerations are small, but others can be very deep, sometimes even affecting the muscle or tendons. The main issue here is bleeding, which can be mild or heavy depending on how deep the cut is. Example, accidentally slicing your hand while preparing food. Number 2, puncture wound. Let's move to puncture wounds. This happens when a pointed object like a nail, needle, or even an animal bite pierces to the skin. And here's what makes it tricky. Puncture wounds usually look small on the outside, but they can go deep inside. This means bacteria can get trapped, making infections like tetanus a big risk. Example, stepping on a rusty nail. Number 3. Avulsion. This is one of the more severe wounds. An avulsion happens when a chunk of skin or tissue is completely torn away. This usually results from major accidents like car crashes, machinery accidents, or explosions. The danger here is massive bleeding, and most of the time, surgery is required. Number 4. Penetrating wound. Now from there, let's move on to the penetrating wounds. This occurs when an object enters the body and creates a deep tract or channel. The common example are stab wounds or gunshot wounds. The thing is, what we see on the outside might be just a small opening, but in the inside of the body, the damage can be far more severe, affecting organs, blood vessels, or bones. Lastly, number 5, impaled wound. Let's talk about impaled objects. This happens when a foreign object like glass, metal, or wood remains stuck inside the body. And this one is very important. Never remove the object yourself. It might actually be stopping the bleeding by plugging the wound. So instead, stabilize the object and wait for professional help. First aid for open wounds. Alright, now we know the types of wounds. Let's move on to the first aid treatments. Not all wounds require the hospital visit if they are small or shallow. But for deep wounds, heavy bleeding, or impaled objects, first aid is critical while waiting for medical help. Now we can remember the steps easily using the acronym D, E, P, and T. Stands for direct pressure, E for elevate, P for pressure point, T for transport. So let's break each down step by step. Number 1. Call for help. The very first action shall always be the call for help. If the wound is serious, like continuous bleeding, a stab wound, or an impaled object, don't hesitate. Call emergency services right away. Number 2. Expose the wound next. Expose the wound by carefully removing or cutting away clothing around it. This lets us see how bad the injury really is without making it worse. Step 3. Keep the patient calm. Then keep the patient calm. You see, panic increases when the heart rate, which makes bleeding worse. Reassure them, talk to them, and limit movement. Direct pressure. Now let's move on to D in deep. Direct pressure. Apply firm pressure directly to the wound using a clean cloth, bandage, or gauze. If the wound gets soaked with blood, don't remove it. Just add another layer. E. Elevate. The next step is E. Raise the injury part above the level of the heart if possible. This helps slow blood flow and reduces bleeding. For example, if the hand is bleeding, keep it lifted. P. Pressure point. Then we have P for pressure point. If the bleeding continues even after direct pressure, press on the artery that supplies blood to the injury area. For example, press inside the arm or the groin depending on where the wound is. Next is T for transport, and finally T for transport. Once bleeding is under control, make sure that the patient gets to a hospital as soon as possible for further treatment like stitches, surgery, or tetanus shots. Extra reminders. Always use clean materials to cover the wounds to avoid infection. If there's an impaled object, don't pull it out, just stabilize it. If the wound comes from an animal bite or rusty object, a tetanus shot is necessary. Avoid using traditional remedies like leaves, toothpaste, or powder. These don't help. They actually make things worse. Conclusion. So to wrap it all up, open wounds may seem simple but they come in different forms. Lacerations, punctures, avulsions, penetrating wounds, and impaled objects. Each type has its own risk, but with proper first aid, calling for help, applying pressure, elevating the wound, and transport the patient, we can control the situation and even save a life. As a criminology student and a cadet, I believe it is my duty to always be prepared in emergencies, not only for myself but also to help others when they need it most. So the key is this: stay calm, act quickly, and always do right steps. Thank you.
Good morning everyone, my name is Mark Christian P. Morales, 21 years old, from Barangay Mailom, Bago City, and my course is Bachelor of Science in Criminology in Bago City College. My report is about heat cramps and heat exhaustion. First, we will tackle heat cramps. So what is heat cramps? Heat cramps is painful and voluntary muscle spasms, often occurs after vigorous exercise, especially in the hot weather. Can happen to anybody, even a well-conditioned athlete, most often in leg and calf muscles. The exact cause is unknown, but though to be usually related to electrolyte imbalance that occurs during exercise, accompanied by dehydration due to working in a hot environment. So we have three treatment for heat cramps. So first, if a patient experience heat cramps in a hot place or hot area, you must remove him in a nearest and cooler place. Number two, have patient lie down in a comfortable position so that the muscle can relax and can rest. Number three, you can give the patient enough water but not too much. So sa heat cramps, sinasabi dito na kadalasan daw ito na nangyayari kapag ang tao ay may ginagawang mabigat na bagay sa mainit na lugar, at wala kahit sino pwede makakanas ito, kahit daw mga atleta na kahit nasa magandang kondisyon ay maaaring makakanas nito. At sa di pa malamang dahilan kung ano talaga ang rason kung bakit nakanasin itong ng tao. Pero ang binabasihan dito sa mga related na nangyayari daw dahil daw sa mga tao na gumagawa ng mga mabibigat na bagay sa mainit na area at sa mainit na panahon. At meron sa sinasabi dito na may tatlong treatment ng kapag daw ang pasyente makakanas ng heat cramps sa mainit na lugar, maaari mo daw ilipat sa mas malapit na lugar at mas maginaw. Sa pangalawa, ang pasyente daw ay dapat makahiga at maging komportable para ang muscle na apektado ng heat cramps ay makarelax. Sa pangatlo, maaari mo daw itong bigyan ng tubig, ngunit hindi sobra, dapat sakto lang. Now we will tackle about heat exhaustion. So what is heat exhaustion? Heat exhaustion occurs when a person is exposed to a high temperature and often combination with a high humidity. May also occurs as a result of vigorous exercise in a lower temperature. A person experiencing heat exhaustion sweat profusely and become lightheaded, dizzy, nauseated. The blood pressure may drop, causing weak pulse, and the patient may report feeling weak. So in the heat exhaustion, we have three treatment. Same with the heat cramps. So first, we have treatment na number one, move to the colder place. Same with the heat cramps. Na number two, give fluids, mouth but not too much because the patient might be nauseous, vomiting, and unconscious nang hindi di, nang hindi hindi mo siya mabibigyan ng sobrang tubig na mainom kasi wala pa siya sa tamang kondisyon para makainom ng maraming tubig at baka maglala pa yung sitwasyon o kalagayan ng pasyente. Sa number 3, arrange transportation to the nearest hospital or medical facility nang mag-prepare daw ng masasakyan ng pasyente para madala ito sa mas malapit na medical facility para maagapan o mas mapagaan yung kanyang kalagayan. Yan na po. Salamat.
Good morning, everyone. I'm Cadet Captain Chitson John D, second class of Class Makalikon 2024-2025 from Purok 2, Barangay Bliwagan, Sandriki, Negros Occidental. Date of birth, December 20, 2004. Educational background, elementary level, Maranatha Christian Academy. Secondary level, Our Lady of Purity Academy. Tertiary level is now on Bago City College. Course, Criminology student. Now, I'm gonna discuss about heat stroke. Heat stroke is a severe condition that occurs when the body temperature rises, overwhelming its ability to cool down. It's the most serious form of heat injury and require emergency treatment or prevent damage to vital organs or prevent death. Heat stroke is an emergency that requires immediate action because the body temperature must be lower. The patient body temperature rises until it reaches a level which brain damage occurs, characterized by dry and red skin and feel hot to touch. The patient may be semi-conscious, but as body temperature rises, the patient will rapidly lose consciousness. This means heat stroke is really a serious emergency that requires immediately treatment or action to lower the temperature of patient because if not treated immediately can cause brain damage that may also result to death. Here are the treatment for heat stroke. Move patient from the heat and into cold place. This means if the patient lost conscious in a hot or heat place, you must move him into cold place immediately because the hot place is one of the cause of heat stroke and to prevent the temperature rise more. Number 2. Ensure patient privacy and ask for consent to remove the patient's clothes down to his/her underwear. This means make sure to ask first the patient if he conscious if you can remove his clothes to reduce the heat he experiencing. Number 3. Soak patient with water. Cool with hose shower each. Number 4. Place ice pack and ground and armpits. This to help reduce his/her temperature. Number 5. If patient is conscious and not nauseated, give a small amount of water. Always remember that if the Patient is thus conscious, do not give him any water. And if conscious, just give him small amount of water. And for the last one, number 6, transport to the nearest hospital or medical facility. That's all. Thank you.
Good day everyone, I am discussing nosebleed and first aid treatment for nosebleed. To formally introduce myself, I am Cadet Captain Clarence Olopimo, 2nd class of Bago City College Air Force ROTC. I am 20 years of age and currently residing at Barangay Bagroy, Bago City, Negros Occidental. I graduated my elementary education in Bagroy Elementary School and my secondary education in iTech Computer Education Incorporated, and I am a third year student here in Bago City College taking a Bachelor of Science in Criminology. I am a graduate of Cadet Officer Candidate course with Duty Award and Loyalty Award on May 10, 2025. I am also a student leader here in Bago City College. I am a member of different clubs and organizations, not just a member but also an officer in different clubs and organizations. Just like in criminology department, I am the sergeant at arms, and I'm also the sergeant at arms in Bago City College Judo Club, and I am the vice chairperson for external affairs and disaster resiliency youth volunteer in Bago City College. Nosebleed. Nosebleed is the bleeding from the blood vessels of the nose. Nosebleeds are primarily caused by local factors like dry air, nose picking, allergies, or minor injuries, which can irritate the delicate blood vessels inside the nose. So, let's go now to first aid treatment for nosebleed. If we encounter any person with bleeding or with nosebleed, just ask him or her, or just ask the patient to sit and lean forward slightly and maintain open airway. It is our first step. Second step is to instruct patient to breathe through mouth. Third is to pinch the soft tissue of the nostril or place a dressing between the upper lip and the gum and apply pressure about 5 to 10 minutes. So if we can find here the soft tissues in our nostril, pinch it for about 5 to 10 minutes. We can also use another method or put a dressing in the upper lip between our upper lip and the gum for about and apply direct pressure for about 5 to 10 minutes. Fourth is keep patient seated and still. Ask the patient to be relaxed and be calm. Fifth is to do not pack the nose. Do not put anything inside our nose or put a tissue or dressing inside the nose, for it is ineffective, for it may cause further injury or it may cause blood clot, and that may cause for difficulty of breathing. So six, do not remove any object you may find inside the nose, for it can cause further injury. If the bleeding does not stop, it is our last step. That is to call for help or transport immediately if bleeding did not stop. So that's all for nosebleed and the treatment for nosebleed. So thank you everyone.